Great. Good evening, everybody. Good evening. Thank you all and welcome back. I think a few of you came to the previous Bousfield lecture that we had here on Monday. So for those of you who are joining us for the first time, welcome to the Bousfield Lecture Series. This is something we do every year where we welcome some of the best and brightest practitioners and researchers doing work on urban systems from around the world to the Department of Geography and Planning. So my name is Michael Widener. I'm the chair of the Department of Geography and Planning. And before we get started, I'd like to do a land acknowledgement. We acknowledge that the land on which the University of Toronto operates has for thousands of years been the traditional land of the Huron-Wendat, the Seneca, and the Mississauga of the Credit. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we're grateful to have the opportunity to work on this land. So with that, it's a pleasure to welcome you here to University College. This is a beautiful space, renovated fairly recently. We found it to be a rather cozy refuge from the weather outside, so thanks for making the journey in. Before I introduce our distinguished guest, I want to take a moment to acknowledge the sponsors of tonight's event, beginning with John Bousfield, in whose honor the Distinguished Visitorship in Planning was established, as well as his colleagues from the firm that takes his name, Bousfields Incorporated, which is a preeminent planning firm in Ontario. I'd also like to thank former instructor of the program, Mitch Goldhar, whose generosity together with Glencorp, Greywood Developments, the estate of James Stewart, and the University of Toronto Connaught Fund have made this visitorship and this evening's lecture and reception possible. So as I mentioned, we had an earlier talk on Monday that was given by Renee Gomes, who's a practicing planner, worked in industry in the public sector for many years. And one of the things that I think is quite special about this event is that we're able to bring people who have very real on-the-ground experience here in Toronto, as well as international superstars, if you will, doing groundbreaking research in urban planning and urban geography. Into our program to interact with our students and to give this lecture. And so I'm happy to welcome this groundbreaking researcher, Dr. Rafael Pereira, as our distinguished speaker for tonight. Rafael is a senior researcher and a policy analyst in the Brazilian federal government at the Institute for Applied Economic Research, where he leads the data science team. He earned his PhD in geography from the Transportation Studies Unit at Oxford University in 2018 and has been terrifyingly productive since then. Driven by his interest in transportation justice and sustainability, Rafael has made important scholarly contributions, including more than 50 academic papers and 3 books that have helped planners better understand how urban and transportation policies shape and spatially organize our cities. Rafael is also well known for his work developing open source computational tools and methods for studying urban systems and transportation networks. Notably, his leadership on the R5R routing package has helped many of us, including myself, incorporate realistic transportation measures into our own work. Tonight, we look forward to hearing more from Rafael on his work to make cities more inclusive and equitable by improving transportation accessibility for all. So I'm excited to hear more about your project, Rafael, and with that, please welcome Rafael.
You guys can hear me well? Okay. Just setting up. So I have to time myself, otherwise I'll spend too much time speaking. Just a second. Okay, good. Well, considering the weather, I think I should thank you, each and every one of you, for coming. I know it's a very difficult moment these days, but especially today. So thank you all for coming here. So my name is Rafael Pereira, and I'm very, very humbled and glad to be here presenting for you today. I'll try to walk a little bit here. So I work in Brazil at the federal government at the Institute for Applied Economic Research. And I think it's a very sweet spot to be, because IPEA is an academic institution that is halfway academic, the hybrid institution. We're half academic and half policy decision-making. And because of that, we have this very privileged position of making the bridge between cutting-edge research in academia with policymakers, but also bring data and policy challenges to academic research as well. And a lot of the work that I've been doing over the past 10, 15 years has been derived a lot of the from inspiration and challenges that I've seen in policy, but also in academic research. Many authors who are here also in the room as well. So my research agenda has been scattered across many different topics and fields, but I guess one unifying theme of everything that I've been doing over the past 15 years is really talking about accessibility or access to opportunities. But because this could be like a broad audience with various people with different backgrounds, I just wanted to make sure we're all on the same page and we have a common understanding of what exactly do we mean by accessibility. So one way to illustrate what we mean by accessibility is imagining yourself a person in the middle of a city. This is the city of Porto Alegre in the south of Brazil, but this could really be, any city like Toronto, New York, or Tokyo, or any other mid-sized city in the world. And like in pretty much any city, you have several opportunities and activities available for people. Here we have dozens of restaurants, but we could think about schools, religious centers, healthcare facilities, employment opportunities, and so on. The area you see in yellow, the polygon you see, shows the area that's reachable by this person taking public transit within 30 minutes. So the area is literally telling us what of those opportunities are actually available to the person, and consequently what opportunities she's excluded from. The thing is that there are many different ways in we can expand a person's access to opportunities, right? And there are different strategies with which we could do that. The most obvious one is expanding people's accessibility by improving speed, the speed with which people travel. When we improve the network connectivity of our transit system, or you improve the speed of transit vehicles or cars, we are basically expanding the area or the polygon that person can reach. And so the person will be able to access other restaurants that are further away. Another alternative is simply looking at proximity. Instead of expanding people's speed, is increasing the collocation between people and activities. This can be done, for example, with land use regulations and policies that help improve population density in the city center, or allow for density of activities and land use mix. Now, it's curious when you think about historically that most transportation planners and transportation engineers, when they have to, and politicians as well, when they have to prioritize how do we improve people's access to opportunities, they are mostly concentrated on the solutions at the top, right? But you can guess of those alternatives, which one is more environmentally sustainable? You guessed it right. So this is kind of a very common basic explanation of what accessibility means, or much more nuanced to that. But one thing that I want to get straight is why thinking about accessibility matters. And I think it's fair to say that accessibility matters from several points of view. From a human development perspective, providing people's access to schools, healthcare, services, theaters or cinemas, or even green parks, allows them the freedom that is necessary for them to participate in out-of-home activities and develop their human capabilities. From a sufficientarian perspective, it's essential for people to be able to access those services so they can satisfy their basic needs. It's critical that you have some level of access, some minimum level of access to grocery stores or kindergartens or healthcare facilities so you can satisfy your basic needs and provide for you and your family. From an egalitarian perspective, I think it's fair to say that for every modern theory of justice and political philosophy, inequality of opportunities is a fundamental concern. And thinking about accessibility or urban accessibility allows us to have a more explicit understanding of the spatial dimension in those inequalities of opportunities. Not only how inequalities of accessibility furthermore inequalities of opportunities, but also how inequalities of opportunities will also entrench segregation and spatial poverty traps. And finally, from an environmental perspective, it's very fair to say that various studies have been showing that the more access people have to services and opportunities and so on, the better able they are to make transportation travel mode choices and consequently making more sustainable mobility choices. And this is not just theory. There has been several different academic papers with empirical evidence showing causal evidence that providing better accessibility to individuals improves their participation in out-of-home activities. They have higher chances of finding jobs, and we improve school outcomes and health outcomes, especially for children and especially for girls. And also that places with higher accessibility will also lead to, and shocks that improve people's access will also lead to to different travel mode choices that will lead people to make more sustainable choices and have less environmental emissions. So I think one bottom line of all this message, and I think I'm preaching to the choir here, but is that accessibility helps us articulate a human-centered approach to urban planning. It's not about housing planning or education planning or transportation planning. Accessibility is a key concept that helps us articulate all of those different silos in policymaking. And it allows this holistic understanding of the relationship between housing and land use and transportation and public services and where people live and where people go to, the activities they need to attend. And it helps us have this broader understanding of the geography of opportunities in cities more widely. This is all very abstract and very theoretical. So I guess most of my presentation will stay at this level of abstraction, but I want to give you just a very quick flavor of how we can measure accessibility from a practical point of view. There are several ways we can measure accessibility with different indicators, different data sets, and this is a very simple, probably one of the most simple ways you can measure accessibility. Here we are simply measuring for the city of São Paulo how many jobs a person can reach within 60 minutes taking the public transit. So imagine you go out of your home and you have 60 minutes to travel in any direction you want for 60 minutes by transit, and then you count all of the jobs that you could potentially reach within that travel time. So this is the result for São Paulo. And even if you're not familiar with São Paulo, you look at a map like this, you can immediately see the large capacity transportation corridors. You can see where the subway is. You can actually spot some very bright places. Those are subway stations or train stations. But I always like to emphasize this part here on the extreme right. So that's the East Zone or Zona Leste, which is a famous zone in São Paulo, which is famous for being very economically deprived, very poor socioeconomic indicators, very little economic activity happening there. Why do you guess there is a bright dot over there? Any guesses? Airports? Airport is a good guess, but that's not the airport. What? A factory would be another alternative, but that's not a factory. So this bright point here on the right, yeah, that is a subway station. So what I really like to stress about this map is that the map is not about the spatial distribution of jobs. It's not only about where factories or airports, where you have a higher concentration of jobs is, right? It's about the locations from where you could reach those jobs. And because there is a subway station there, surrounded by this black area or dark area with a desert of opportunities, if you can quickly reach that subway station, with that subway station, you can very quickly connect to the rest of the subway network and to the city center. So when we think about accessibility, it's not simply about the spatial proximity between places, but it's also about the spatial temporal proximity between places. It's about how our transit systems collapse space and time and allows you to very quickly, cover very large areas in the city and connect to different places. Another way to measure accessibility, but in a different way, is here looking at the travel time that takes you to go to the closest hospital in the city of São Paulo by transit. So if you live in areas that are like yellowish, That's a place from where it would take you less than 5 minutes to get to the hospital by transit. You could probably just walk to the hospital. Areas which they're greenish are places from where you would take between 10 and 20 minutes, and dark blue places are places which would take you more than 30 minutes, or kind of an opportunity desert to some extent. So this gives us like a very general idea and understanding, okay, what accessibility is theoretically, and empirically an interesting but very simple way to measure this. One thing that I like to emphasize is that we can think about so many different sophisticated ways to measure accessibility. We can think about gravity-based models and intervenient opportunity measures and computational measures, and they're very hard to communicate. Every time I present this map to a policy decision maker in Brazil, their eyes pop up. Because one of the most powerful things about accessibility is that it not only allows us to have this holistic understanding of things, but people can relate to maps like this. So in the second part of my talk, I want to give a very general overview of how much progress we have made over the past 10, 15 years. Because we've been talking, if you look at academic literature, we have been talking about accessibility for like over 60, 80 years. And sometimes we lose sight of how much innovation and how much new things have been coming up over the past 10, 15 years. So I just wanted to give a very brief overview of how much progress we have made before I talk a little bit about how much more we have yet to come. So nowadays, if you want to measure accessibility, like in the past, like when Steve was doing your PhD, it was probably very hard to do these calculations and computations, like 5 years ago, right? Yeah, and imagine like in just like 10, 15 years, a plethora of open source routing engines and computational tools have been coming up. There are several of them just for doing the most sophisticated multimodal transit analysis. So let's say you go on Google Maps and you say you want to go from here all the way to the city center, and Google Maps will tell you, go out of the building, walk along the sidewalk, wait for 10 minutes, get the bus, and so on and so forth. So these are tools that gives you door-to-door travel time estimates in the most realistic way possible. And these are all for free. If we're looking at more simple transportation modes like walking or cycling, or even cars, there are many more alternatives. So there are a bunch of options nowadays. To do of this accessibility analysis, you also need a lot of data. Apart from the PDFs that we scraped and digitized, we need a lot of data sets that nowadays, the good news is that there are global data sets that are openly available to everyone. So one first type of information that you need is to know where people live. And nowadays, there are at least 4 different sources of gridded population estimates at very high spatial resolution for all of the planet. You probably need road networks. And there is also nowadays, OpenStreetMaps has been around for a while now. And they usually have very good coverage, especially for developed countries. But even in developing countries, they have very good coverage for large cities and mid-sized cities as well. They tend to be a little bit worse in rural areas. But even in Africa, they have been doing a terrific job with crowdsourcing all this information and mapping. Topography, it's also very important to consider how hilly your city is, because the elevation or the digital elevation model will tell probably how your routing will change. If you're a pedestrian or a cyclist, which route you should probably take. And the good news is that all of these data sets are openly available and for the entire planet. So any person now with a laptop on a chair could just download any of these data sets for any city in the world and do some basic accessibility analysis. But of course, this is not all. Like we also need, if we're going to do public transportation accessibility, we also need GTFS data, which is a standard data format for public transit. And I could have a whole lecture just talking about how amazing GTFS is and how it has revolutionized our research and transportation planning, because it has created this common ground for learning. And we are doing software that people in Washington, D.C. are developing software that works with GTFS. And us in Brazil are benefiting from this, and people in Canada, in Tokyo, in Japan, and everyone is using and building all of these open source tools largely because GTFS has become this common standard that we all share. Some cities and some countries share their GTFS openly available. In some countries like Sweden, in Canada, you actually have national repositories of GTFS. I don't say this lightly. There are very few countries in the world where you have such an organized way to share public transport data for the entire country. Canada and Sweden are probably two of the very few countries that do this. And we in Brazil, we envy a lot of the situation. You'll probably also need land use data. You need to know where the households are, and where are the jobs, where the pharmacies, the healthcare facilities, the green parks, and all of that. And there are various different data sources from where you can get those data sets, but these are usually very scattered. For Canada and for Brazil, there are a few sources that are available, but I guess like there's much more work to be done with administrative records for several places. In the academic literature, we have also been making lots of progress in creating new accessibility metrics. So those two maps I showed you are two very simple ways to measure accessibility. But over the past 10, 15 years, since 2018, 16, there has been several papers by colleagues here in this room and broadly in mobility justice and in Canada and in the United States, who have been promoting like different and new accessibility metrics to measure competition. So when you think about accessibility competition, is that it doesn't matter so much whether you live just 5 minutes away from the hospital. If that's the only hospital in the city, the hospital will be congested, right? So a lot of people will be in the hospital to get some service. And you'll probably be, 5-minute walk to the hospital, but you have to be sitting there for 30 minutes to get your appointment. So surprisingly, there has been like a number of papers proposing new ways to measure accessibility while accounting for those competition metrics. Some new recent studies trying to look at environmental costs. We usually think about accessibility in terms of how many jobs you can reach within a certain number of minutes, but we could think about their pollution costs and emission costs and monetary costs. And some studies have been trying to bring this more environmental perspective into thinking about the environmental cost of accessibility. Because obviously, the number of jobs you can reach within 30 minutes by car is very different than the number of jobs you can reach in 30 minutes by bike. But also the environmental cost of those differences are very, very startling. There has been some recent studies trying to think about accessibility as a way to measure urban segregation. If accessibility is how easy it is for you to meet and interact with opportunities and people, new studies have been trying to look at how accessibility allows you to think about the co-location of different socioeconomics and demographic groups. And there's two other accessibility metrics that myself and colleagues we created in our group, and I didn't know how to classify them, but they are fascinating, super important. The best accessibility indicators you will see, they're huge. And we're basically in these indicators trying to, one, minimize computational biases and temporal biases in the measures we use. And more importantly, in this one, in the last one, we're trying to look at how accessibility can be more directly implemented in policy decision-making and transit, in the design of transit network systems. I guess what makes me very optimistic is that one of the most important advances we have made over the past 15 years is that while it was very difficult to calculate accessibility in the past, nowadays it's becoming so much easier and cheaper that we have been seeing a growing number of countries which are leading national accessibility projects, meaning they're building accessibility estimates for the entire country or for most of their cities in several places, starting with David Levinson in the United States, colleagues like Henrique in Finland, David Levinson again in Australia, United Kingdom, ITF, and the European Union, and our group in Brazil. The three, four places I'm highlighting here with the stars is because these are not academic initiatives. These are initiatives led by governmental agencies. So in the case of the Netherlands, Brazil, and the European Union, they are led by governmental agencies. Canada, though, has 2 stars. Any guesses why? That's Steve. No, I'm sure Steve has a lot to do with this. So Canada is at the moment a very special place for urban planning and accessibility analysis. For, I don't know, Steve and Toronto University and many colleagues across, Ahmed Ognadi and colleagues across the country, they have been doing a terrific job in creating an interesting environment, not only academically, but also in terms of policy. And this has led Statistics Canada to be the first official statistics office in the world to build official accessibility estimates for the entire country. And this has a tremendous effect when you think about policy planning and evaluation, and communities asking their governments to reorganize their transit systems or replan the spatial organization of schools and childcare and so on. So I'm sure it's fair to say that Steve, Michael, and many other colleagues here in Toronto and in Canada, they have a tremendous, they have been having like a tremendous influence in leading Stats Canada or supporting Stats Canada in doing this. Because this is not an easy feat. We've been trying to do this in several other places, and Canada is the first one to do it. And so kudos to Canada and the Mobilizing Justice team. It's been very, very great work. And that's why I'm very humbled to be here speaking in front of you. So in my work back in Brazil, we have the Access to Opportunities Lab that I've been leading with the Brazilian government and with local governments as well. And some of the work that we've been doing there in a much smaller scale is trying to do our national accessibility estimate. So we've been generating annual estimates to employment, healthcare, education, and social welfare for every city block in the 20 largest cities in the country. And we're making this with open data. We're making all the data sets available and so on and so forth. We've been doing this for a few years now. We have to stop because of the pandemic. But now this year, we are resuming our project and re-estimating some accessibility estimates from 2012 to 2022 onwards. In the past, we did this for the 20 largest cities in the country, but now we're going to do this for the 187 statistical metropolitan areas in the country. So this should cover approximately 50% of the Brazilian population. So imagine you have for every city block in all of those cities, you have access to employment, like jobs of low, middle, and high education, healthcare of middle, low, and high complexity, different types of education services, social welfare for men and women at peak time and off-peak, for blacks and whites and other indigenous communities as well, for different ages and different income levels. Am I missing something? So what we have here is like, it's not one paper, it's a project, it's an umbrella that is providing a public good with several indicators and a very rich data set that can be explored by academics, policymakers at various levels of the government, and so on and so forth. We have actually used a lot of this data in several publications. We have been seeing study after study that systematically low-income and Black communities in Brazil, they have systematically lower access to employment opportunities and public services in pretty much every single city in the country. This was actually the case for access to COVID-19 healthcare during the pandemic crisis. And we have also teamed with a number of collaborators from different countries trying to use the Brazilian data in a more comparative analysis, looking at how accessibility to jobs would compare across 117 cities in different countries. Canadian cities, if you're looking for them, are the red dots here. And you see that access to employment by transit in Canada is much better than cities in the United States. And perhaps not surprisingly, accessibility by car in the United States is much better than in Canada. What I was really surprised when I saw this chart for the first time is that I wasn't expecting Chinese cities to perform so well. In pretty much every transportation mode, Chinese cities outperform their peers in population. And I guess this speaks a lot to the role of proximity in creating vibrant cities and inclusive cities. Along the project that we have in Brazil, we have been developing, to develop the project, we need to do some computational analysis and methods. So most of the methods that we have been developing, we try to put them in computational packages in R or in Python. These are a few of them. And I just wanted to highlight 3 of them very quickly. The first of them is R5R, which Mike already said. And I think, I guess, honestly, a lot of people say, Rafa, congratulations, it's an amazing work. But I guess I always want to emphasize the heavy lifting, like the people who really deserve the credit is the people who work at Conveil, like Anson Stewart, Matt Conway, he was one of the first core developers of R5. We were really just building on the shoulders of their work. The thing is, R5, which is this amazing routing engine, super fast and super efficient, is written in Java, a computational language that urban planners and transport engineers we're not very familiar with. So we decided to build R5R so you can run R5R, you can run R5 in R, and R5Pi so you can run R5R for R5 using Python in your computer. One of the highlights is that R5R has been downloaded almost 1 million times. If I had just like 1% of those in citations, it would be good. But it's okay. I'm happy with the downloads anyway. But I guess the most important highlight, R5R is actually used by Statistics Canada to generate those accessibility estimates by public transit. And I think that's a lot to do with the work that people here in Canada, they have been using R5R a lot and recommending. So if you like R5R, recommend it to your friends. And if you don't like R5R, recommend it to your enemies, please. Another package that I want to mention is called accessibility. So as I said, the academic landscape of accessibility includes hundreds, not hundreds, but like a few dozens of accessibility metrics, and hard coding them in your computer every single time is kind of a bit of a tedious task. So we created the accessibility package, which allows you very, very conveniently to calculate pretty much any or most of the accessibility metrics that exist. And we also we have a very long research agenda on transportation equity and transportation justice. So you can actually use this package to calculate different measures of transportation inequalities or transportation poverty. And this is a collaboration we've been doing with Steve and Alex Karner. And a lot of the metrics we've been discussing in the literature are already here. So if you're a student or a researcher or a policymaker and you want to analyze what is the level of inequality of access to employment opportunities in your city, if you build a new subway or if you remove a cycling lane, for example, like hypothetically, if you remove a cycling lane and how it would affect your accessibility, you could simulate what would be the impact of that intervention in your accessibility, poverty, or inequalities of accessibility. Most importantly, and this is especially important for PhD students and postdocs, this is the package called AOP data. So AOP is the Access to Opportunities Lab. And the AOP data is the R package which you can use to download all of those data sets for Brazil that we have been developing. And in one single call in R, you can use the read access function to download accessibility estimates for the city of Curitiba during off-peak time by transit. And in one single line of code, you can create this map with ggplot. I always like to ask, is this the most beautiful map you have ever seen? Definitely not. But it's incredibly empowering to see, a student that knows very little R or a local policymaker that knows very little R. With 2 lines of code, they have that access, they have like that data readily available to them, right? So what I always say to students and postdocs, if you're building a new research method, or if you're building research data sets in your project, make them available to the public. The impact of your publication or of your academic achievement is not your paper published in a journal. It goes beyond that. Because if you want your paper to have some impact on people's ideas and minds, you need to make these things happen. And you need to make them easily available to others. And I've been having this feedback, this constant feedback, that a lot of people come to me and say how our packages are great. Very few people come to me and say, hey, that paper was amazing. I guess like the feedback is very different. And I guess it speaks a lot to how we can we can actually think about, how we can expand the impact of our research beyond simple like academic publications, which are amazing, they're very important, but this is also very good as well. We have also been developing some, interactive dashboards, because if you want to reach policymakers and communities, in our package, we'll probably not reach them. But if you put on your website a very simple interactive dashboard that people can click and zoom into their neighborhood and where they live and understand how changes to the transit network happen, these interactive dashboards can become very, very powerful tools as well for public engagement. We have written an introduction level to teach policymakers in Brazil, and we were teaching them how to do this accessibility analysis to incorporate accessibility evaluations in transportation planning and investment. If you're doing an investment or like building a subway or expanding a bus line or just building a new BRT, you need to understand the cost of those investments, but you also need to understand who benefits and how that benefits is distributed across the city. And we created a simple course with a few days of like hands-on course for policymakers in Brazil. And a result of that was this book. And the book is already being used by a few graduate courses across different universities, so we are very happy with that. And the good news is that Chris secured a contract with Routledge and CRC Press. So now we are writing a sequel of the book, more focused on the advanced topics on accessibility modeling analysis. And hopefully we're going to get this book done at some point this year. Finally, so I don't have much more time. I think I've already said a lot of things about, how good things are. We've made a lot of progress, a lot of new indicators, new data sets, new computational tools. But how far we have yet to go? What are we missing? And I guess we do a very good job in measuring what we can easily measure. But I think we do a very poor job in measuring what things that are very hard to measure. And we don't make the last mile effort in doing that. So we look a lot about, looking at access to healthcare, okay? But healthcare is a very broad category. Are you looking at MRIs or, dialysis? There are some services which are very critical in terms of time and access, and we should be doing a much better work in doing that. If we want to understand how accessibility has an impact in people's health outcomes or employment outcomes or services, we need to have a better understanding of the qualitative differences between these destinations we are looking at. From a spatial temporal perspective, we also need to have better information about the working hours of those facilities. We rarely have a look at those because we really have no data. You can go on ChatGPT and ask, what are the opening hours of bakery shops in hospitals, but you might not get the correct answer. Capacity and congestion, I think we're making some progress there with all of the new indicators we were building, but I guess there are too many indicators now, and we actually need at some point to have a benchmark of how those competition-based metrics compare to one another, what are the benefits and disadvantages of each of those. We are doing a terrible, terrible job into looking at people's personal characteristics. We rarely pay attention to gender differences in accessibility because the tools we are using, R5R, OpenTree Planner, or all of these routing engines, they do not account for several things that are fundamental for people's well-being and travel satisfaction, like how safe they feel when they're doing their trip, how crowded is the bus, whether they have any physical disabilities that allow them to overcome small barriers on the pavement or the sidewalk, whether they are parents with trolley cars and kids and children walking around. We rarely pay attention to those. GTFS is an amazing data standard, but GTFS is only the scheduled service. That's what was in the contract between the local government and the transit providers. That's what we would expect them to deliver. But this is not always the case. And we have a number of studies that have been starting to use GPS data to have more, calibrated travel times. But we cannot see informal transit. And informal transit might not be an issue in North American cities, but it's a tremendous problem in sub-Saharan Africa, Southeast Asia, and Latin America, and more broadly. I remember there was a study, a contract from IDB. They did a study on informal transit in Mexico City, and over 50% of the transit trips in Mexico City were in the informal transit system. So imagine if you do an accessibility calculation with that GTFS, how representative that would be of your city. And just in terms of methods, we have to look beyond travel time. We're looking a lot about, how much access you have in a certain travel time threshold, but we need more work looking at monetary costs and environmental costs. So I have four final slides, and which tries to set up an agenda for what I think are some of the top priorities that I would like to pursue, and some of you might want to join me on this. The first one is looking at access-oriented network design. We usually think about accessibility as accessibility from a place. How many jobs you can reach from here. But that helps it doesn't really help that much if we want to design, okay, what changes should we do to the transit network to improve that accessibility? And there are a lot of technicalities about how these routing engines work. They only find that the fastest travel route. They don't account for suboptimal trips and so on and so forth. But we have developed an indicator that measures not the accessibility of a given place, but the average accessibility benefit you get from a given transit route. So it's not from a place, it's from a transit line that has some shape and form. I won't go into the technicalities. I see some people frowning like, but the paper was published in Transport Research Part A, and we have like a very detailed explanation in terms of methods of how this works. And more importantly, how this indicator is the most strong predictor of transit ridership. And it makes sense. If what you get from the transit system, like the most important benefit any person gets from a public transport system is the accessibility that that transit system gives to you. The more benefit you have from something, the more you use it or the more you consume it. So it's kind of naturally that we expect that the more accessibility a given transit route provides to more people, the more people will use it. The traditional accessibility indicators that we had was not really catered to do this kind of relationship, measuring the association between transit ridership and accessibility, because there was kind of a spatial mismatch about the unit of analysis here. And with this indicator, we're actually having both analysis at the same unit, which is the transit route, in a way that we account for the upstream and downstream connectivity between each route and every other route in your transit system. So you can actually see how one route adds accessibility to other routes with which it intersects or connects. And this is just to say that I think there is a big research avenue that we could explore. And this would be a very interesting tool to make accessibility analysis more directly incorporated in the day-to-day planning of transit agencies. Because transit agencies don't control the accessibility of a given place, but they do control the accessibility of a given route. 'Cause I know there are a lot of people at MJ, they're doing participatory analysis, participatory planning and accessibility-oriented planning, but I see relatively few people doing this across other countries. And I always like to bring attention to this. This was a part of Anson Stewart's PhD at MIT, and he developed a big tablet where under the hood it's R5 that's running, and you have people, community engaged with the map, and interactively they click on the map to create new bus stops or a new transit line. And on the fly, accessibility analyses are updated and calculated. And this is a terrific tool for consultants and policymakers to have a more direct engagement with communities and have people to understand what are the accessibility impacts of different transportation interventions. And I guess a lot of academics are armchair academics, so they don't do so much of this engagement with communities, although there are very rare exceptions. And I would love to see this happening more in the future. Third, I think we need to think more about the travel cost of our trips. As I said, 80%, 90% of the literature, including myself, we mostly look at travel times. So how many jobs you can reach within a certain travel time budget. But by far, monetary costs are probably one of the most important and understudied barriers in transportation. And it is understudied because people don't have the means or didn't have easy way to measure the monetary costs of transit trips. And why this is important? Because for every single trip from origin to destination, there isn't only one fastest route. There are multiple options. So you can go, let's say, from here to the city center, and it would take you like 50 minutes walking, and you would spend $0. Or you could take a combination of the bus and the subway, and it will take you there maybe 10 minutes, but it will cost you, I don't know, $7, $6. And in between those two options, you have a Pareto frontier of all the optimal combinations of travel costs, travel time, and monetary costs that give you the most efficient frontier of all the transit options that you have available to you. Why this is important? Because a lot of the very few people who are looking at transportation costs, they do generalized travel costs, or they calculate the travel cost of the fastest trip. And by doing this, they completely overlook that there is a trade-off between your travel time and your travel cost. And the problem of ignoring that is that people make those trade-offs every single day. And low-income people, they are poor in terms of money. They are not so poor in terms of time. High-income individuals, on the other hand, they have a lot of money, but they might be poor in time. So the way low-income and high-income individuals will respond or react to those trade-offs is very different. So the way we measure accessibility should be able to account for that as well. In R5R, you now can calculate those Pareto frontiers, and R5R will find for you all of the optimal combinations of travel time and monetary costs for every single origin destination pair of the city in very few minutes. And I think this will unlock a huge potential of research agenda in how we can incorporate we can think about more heterogeneity in terms of agents and how they behave, and how we should be evaluating the benefits of our transport investments, and so on and so forth. But if talking about, accessibility sometimes can be already too technical, doing this with these trade-offs make things even more technical. So I think there's a big challenge here the challenge before was how we measure these things. Now we can measure it. The challenge now is how we can more easily communicate them to policymakers, and how we can make our accessibility analysis more easy to understand without overcomplicating things. And finally, the fourth and final topic is trying to look at the impact of access on outcomes. And I would say this is my favorite one, because we do have this idea that accessibility matters, that the more access people have, you have better jobs and you have better health outcomes and so on and so forth. And those papers that I cited in the beginning, those are very few papers that have been published. There are not many of them compared to an overwhelming literature that do descriptive studies and descriptive analysis and modeling. But relatively fewer studies are able to have a causal identification analysis that have a clear analysis and untangles the causal effect of accessibility on people's outcomes. And this is tremendously important because ultimately, if you think about all of the analysis that we're doing, hold this assumption that more accessibility gets people out of poverty. And that ultimately, if you live in places with better access, you and your children will have better outcomes in life. And that if you live in places which are very poor in access, you will end up in a spatial poverty trap. But if you make an investment in that area, maybe you can get people out of the spatial poverty trap. And ultimately, spatial accessibility could also lead to social mobility on the long term. But those are very bold claims. And I think we need much more robust causal evidence of what we're trying to do. So the idea here is trying to examine how variations in accessibility will impact socioeconomic and health outcomes and ultimately social mobility. I think there are many different challenges to do this in terms of methodological challenges and data challenges. There's always the question of the chicken and the egg, what causes what? Are people poor because they live in places with low accessibility? Or people live in places with low accessibility because they are poor that they ended up living there. So there are a lot of endogeneity or reverse causality, and we need to untangle those phenomena. But to do this, we need long-term analysis of how transport systems change. We would need the GTFS data of Toronto for the year 1991, in the 1980s. And ideally, we would need administrative records so we can track and follow individuals and their families along many years. And this is not very simple to have. And I guess one of the most important challenges here is really like a methods challenge. Because if we look at our urban planning and transportation departments, we have very little training in causal inference and causal analysis. We do a lot of spatial data analysis, a lot of GIS, but we have a lot to catch up with colleagues in political science and economics in trying to understand how can we use this quasi-experimental research design methods to infer causality, like robust causal evidence from cross-sectional data or data which are not really experimental, right? So this was what I had to do today. I think there are many more challenges that I would like to emphasize, but thinking of time, I try to keep my talk for a little bit shorter. I just wanted to finish giving a huge thank you to all the current and former members of the Access to Opportunities Lab. Some of them are here today, and thank you so much.
Rafael, so we have about 10, 15 minutes for questions, but there'll be plenty of time also after that to ask questions to Rafael in a more one-on-one setting. We have a reception next door with food and drinks, so we can continue any conversations that we don't have here over there. So we'll open it up for questions.
Well, thank you, Rafa, for the presentation and great work and for being a great mentor and everything. One thing that you didn't mention on the future of the research on accessibility was on theory, especially on theories of justice. Do you see any, like, any window for that, especially considering other theories that, break from the Rawlsian school of thought, or some things are considered like, I don't know, exploitation, violence, or power dynamics in every sense? Yeah.
I see two different directions. One of them is exploring more critical theories of justice, like Nancy Fraser and colleagues, like even like communitarian approaches as well. And I guess a lot of those studies, they are much more catered into, shining light on aspects of political participation and political struggles of certain groups and minorities. And so I think to a lot of extent, it's easier to mobilize this kind of theoretical perspectives into more qualitative research methods where you conduct interviews and focus groups and you understand historical power imbalances and dynamics in communities. And what individuals and groups have their voice heard and which ones are excluded from the table. But even in a more liberal tradition of distributive justice kind of theoretical framework, I think the theoretical landscape of transportation equity and justice used to be a mess, I think 20 years ago. And I think it's fair to say that over the past 10, 15 years, things are if they haven't really progressed, they're now at least more organized. We now have a better vocabulary to understand what are the concepts and how they relate to one another. But I guess there are very few people who are actually interested in doing transportation like philosophy and to some extent. And I have the feeling that a lot of people stopped at reading at Rawls, like capabilities approach and John Rawls, and that's it. But even Rawls has there are several criticisms to Rawls from the communitarians and even luck egalitarians. Like Paul Romer is like a very prominent philosopher who's been developing a lot of work further in terms of distributive justice. And I think I would see a lot of potential of exploring like luck egalitarianism when you think about distributive justice, for example, in transportation equity.
I'm going to use the chair's privilege here to ask a question. I'm wondering if you could comment on whether or not we need to be thinking about a sort of shift in thinking around accessibility more generally. So, historically we've thought about origins and destinations, but if I really wanted to, I could work at home, I could have groceries delivered at home, I could see my primary care through my computer at home. Of course, there's other things happening out there, but what's the role of accessibility and maybe what kind of tools might we need to adapt to this world that we're living in now?
Yeah. I don't think we need a big shift in the sense that we need to think things that haven't been thought before. I mean, I'm saying this because we have seen papers for the last 15 years, like citing IT and technology connections and digital accessibility and how they interrelate with accessibility. There are a lot of people now doing work on online shopping and how online shopping impacts people's travel behavior. Ultimately, it's about accessibility, right? So I don't see that we need to like revolutionize how we are thinking stuff, but we need to get a more deeper engagement with this kind of literature and this kind of problem. The tools we need to do that, I'm not entirely sure. We would probably need to ask people working with logistics and freight. I think they're probably better able to do this at the moment. But I would say that one impression that I have is that, in the past, there used to be this correlation that between, at least in Brazilian cities and Latin American cities, there used to be this correlation that wealthier individuals, they had higher mobility rates, right? So more wealthy individuals, they would make more trips. Even if they were motorized trips, but they would make a larger number of trips per day than compared to others. And I think this has shifted. And then it has shifted in a very radical way, in the sense that a lot of us are now using home delivery of food, for example, to get food delivered at our doorstep. Meaning that I still have access to the food, but now in a different way. I externalize my transportation cost, right? Meaning now that my privilege is not about the privilege of being able to take my car and go to the restaurant. My privilege is making someone take that trip for me. And in that case, it's mostly like motorcycles or cyclists. This also means that we're impelling on them the health risks of crash accidents and so on. So I guess like there is a big reverse in the association between mobility and socioeconomic status in that specific aspect.
Thank you. Other questions? I'm going to go over here first, and then I'll come back to you.
Thank you for the lecture. I really liked your future agenda slide, and especially the cost part. The cost really reminded me of, have you looked at any costs from like an operational and capital perspective? That's like something I would be interested in looking at, instead of like costs from the like passenger or
Yeah,
human perspective.
we are only looking at out-of-pocket costs. But looking at capital costs and investment would be, this is something that David Levinson and colleagues have done in what they call the total cost or the full cost accessibility. And I think the argument goes that if you look at individuals' behavior, you have to look at their out-of-pocket cost. But if you want to have a systemic understanding of policy, where should we build a transport intervention, then we should be looking at the capital cost. And that would be the only way that we would come to the conclusion that investing in transit is more important and relevant than investing in cars. Because the out-of-pocket cost of car users is very, very little compared to transit. So the argument goes that we should probably be paying more attention to this overall cost and long-term cost of capital to make a more robust justification to why improving public transit infrastructure and the accessibility gains you get from those are more economically important than what would we get from building an overpass or a highway, for example. But I haven't looked at that. If you want to do a PhD or a postdoc, I'm sure there are many interesting supervisors that could help us here. Yes, for sure, yeah. But how much accessibility you gain from each dollar invested in a BRT infrastructure or a subway infrastructure and so on. Yeah, that would be very interesting.
We've done that.
Yeah.
I'll send you the link. It's a nice segue to my question. This was something I was going to ask you maybe over a beer, but I'll do it in front of everybody. I don't know if you've seen the news, but overnight the federal government has dropped the carbon tax in Canada, which has resulted in a one-day up in the fuel price at the pumps. I think it's something like a 17-cent drop in the price of gas pretty much across the country. And I was thinking about difference in difference and shocks and causal models. And if you happen to be in Canada at the exact time that such a shock was taking place, a rare shock, what would you do as a researcher to try to say something interesting? Maybe an article, maybe just some news coverage or a fancy blue skies post, but what would you do to kind of exploit this shock for your own intellectual fame?
I think you already have the answer there. I mean, there's a very clear discontinuity. I think there's a very clear discontinuity within Canada a long time. There's a very clear-cut decision of when taxes affected fuel prices. That would be one interesting analysis. You could do some causal inference with regression discontinuity or something like that. But the other thing is that I would assume that other North American cities near the border would have relatively similar travel behavior patterns compared to some Canadian cities. So that could be an additional control, like a synthetic control of how those travel behavior patterns, like number of trips or vehicle miles traveled, how those would change over time. There's obviously, it's obvious that we shouldn't expect an immediate impact on the same day, because if you have already your tank, you refilled your tank last night, then you're only going to refill it again maybe in a couple of weeks or so on. But I think it depends on how long these tariffs are going to hold, and maybe the cultural war that Trump is, following, trying to pursue, will bring about a lot of interesting natural experiments, trying to look at the bright side of things.
where would you look for mobility data?
I'm not so familiar with the data sources that are available in Canada and in the United States. But Google Maps, nowadays you can query their API like every second to check congestion levels for every road segment. So you can do that, for example. Would that affect congestion, perhaps? That's one possibility. So we could look at congestion as one outcome. But ideally, like when was your last travel survey? 22. When is the next one? It's going to take too long. We need something more real time. Mobile phone devices would be the best second guess, right? I mean, you could also possibly look at ride-hailing trips. I know I have very good friends there, so having access to that data would probably, because ride-hailing drivers are very much affected by these cuts. And so ride-hailing could be an interesting outcome to look at. Oh, and transit ridership. Because if we are, yeah, supposedly, yeah.
Well, before Steve and Rafa write their next paper in real time here, I think we have one more question and then we'll continue the conversation, or we'll do two more questions because there's one question here and we'll do one there.
All right. Thank you for your presentation. That was a good one. Nice one. I enjoyed like seeing your thoughts and perspectives in real time. So then I have two different questions. So what I saw missing from your presentation was on future technologies. So for instance, talking about electric vehicles, autonomous vehicles in particular, and how like that has implications for how we view accessibility. And my second question is on the lighter side. If we could teleport, what do you think what would be the implication for the accessibility land use relationship?
So the first question, actually, I had 5 topics for future research directions, and the fifth of them that I ended up cutting out because of time was about future mobility as a service. And I'm specifically thinking about, dynamic routing for like dynamic transit systems with dynamic routing or ride-hailing services or delivery services. And my research question that I would have in that direction, it was not so much thinking about autonomous vehicles, but it's more about the algorithmic biases that could be present in those services. So a lot of the deployment of these vehicles are driven by AI or general algorithms that can be very complex and very big. Very few people have a good understanding of how internally they work. So there's kind of a black box for most individuals. And there has been, for a number of years now, growing concern about how our socioeconomic biases in our own behaviors and our own daily lives and mobility patterns and urban settlement patterns are somehow reflected into these routing engines and algorithms and so on. So my concern would be more about, algorithmic fairness and how, mobility as a service industry that is trying to come up again could probably entrench that kind of trend. But autonomous vehicles and teleportation, that's very futuristic for me. Even autonomous vehicles, I'm not super confident that we have like, large numbers of autonomous vehicles on our streets in the next 5 years. I would say even 10 years. But maybe I'm just being too pessimistic. Like having some autonomous vehicles, yes, but like a whole fleet of autonomous vehicles, because that's where you'd get the largest benefit of having those vehicles interconnected to one another. I think this will take more than 10 years. And I would love to come again as a visiting professor in 10 years from now to maybe see if I'm wrong or not. Could you put that in your calendar?
All right. For our last question here, please.
Thanks for your presentation. Most of your presentation focused on access by transit measures, but my question is actually about walking measures, particularly because walking tends to be part of most trips. One piece of feedback that we've gotten at the city when we present maps of walking access is that decisions about whether to walk really depend on the surrounding environment more so than they do on distance. And with active transportation in general, cycling, walking, you're so exposed to your external environment that it seems very important to sort of factor in those qualitative built environment factors. And so I'm pretty sure that R5R allows you to penalize different routes based on like traffic stress and stuff. I'm just wondering, when it comes to the pedestrian network, where is the research in terms of penalizing certain routes if there's no shade, or if there's like bad infrastructure, or if you're walking on like a huge arterial road for 15 minutes straight or something like that?
Actually, that's a great question, and I should probably put a slide on that on my next presentation. You're absolutely correct. You know, R5R and a few other routing engines, they allow us to look at level of traffic stress, which, you know, some people might prefer going this route instead of that route to avoid, you know, a lot of traffic pollution and so on. But all of the routing engines that I showed here, they do not account for, you know, visual perceptions of space. There is, though, a growing number of studies in Singapore, the National University of Singapore, Finland, and Hamburg in Germany. They have been using more and more computer vision models and street imagery, street level imagery data. So you can use computer vision models to detect how green the routes are, or how beautiful they are, or how comfortable, or how much shade and green space they have. So they're using this computational models to grab information about the characteristics of the places. And some colleagues in Hamburg, for example, they're using those types of information to recalibrate the weights of their transportation network. We actually done a recent collaboration with colleagues from Hamburg, where we are looking at the presence of armed conflicts and drug militias and crimes in the city of Rio, and how that affects children's access to school. So when a child has to walk all the way to school, they might want to avoid places where, you know, there has been a number of traffic, or like gun shootings, for example, or drug gangs reports. And they use some machine learning and computer vision model to extract information about what places are considered to be more or less safe. And we use this to recalibrate the routing network to see how much more children would have to walk in order to avoid the risk of, you know, going through those shady and sketchy areas. So there is a boiling research in that direction. I think they're much more on the computer vision and part, and gradually we're starting to get those information into the routing networks to do the calibration you're thinking about.
Well, please join me in thanking Rafa for his talk one more time. And you stick around and join us for the reception next door. So thanks, everybody.